As we've been reporting this week, President-elect Trump nominated RFK Jr. to run the Department of Health and Human Services. While his known skepticism for vaccines is causing some concern within the medical community, this morning we're taking a look at some of his proposals to make America healthy again. Those plans include tackling the obesity epidemic in this country, eliminating processed foods in federal programs, and removing fluoride in the nation's water. Let's bring in twin doctors Jamil and Idries Abdur-Rahman. Docs, welcome back.
Hey, how are you?
I'm great, better now. Let's start with the big picture here. Dr. J, your thoughts on this appointment firsthand?
I'm excited about it, to be honest with you.
Okay.
I think that when you look at this, oh yeah, absolutely. When you look at the state of healthcare in America, something's got to change, right? I mean, consider just a couple of things. Right now, 70% of Americans are either overweight or obese. By the age of 19, 25% of people are on a prescription medication. Seniors, 85% of seniors. Non-senior adults, 50%. We spend more money per capita in this country on healthcare than any other industrialized nation, $14,000 per year. Yet we have some of the worst outcomes. You look at Europe, for example, where people live 3 years longer than the average American. And it's not just that they live longer, they live healthier lives. Look at Italy, which is kind of like the bellwether for Europe. They live 6 years longer than we do. So change is necessary. And I think anybody who's arguing against change would have to ask what they're arguing against. I think RFK represents that. So I'm actually really excited about it. I think it's kind of gotten a bad rap when people talk about the anti-vaxxing thing, for example. It's not necessarily that he's an anti-vaxxer per se. I think that he's just for transparency. He's basically saying like, hey, people need to know what are in vaccines. They need to have an idea of what the efficacy of these vaccines are. They need to know what the risks are, and then they need to be able to make an educated decision. So I think he's kind of gotten a bad rap, and I'm excited. Change has to come. Anybody on the front lines of healthcare would say things aren't going well right now.
Well, Dr. I have to ask your take now.
Yeah, he kind of summed it up. I agree with Dr. J. I mean, we have a great healthcare system in the United States. I know, all right, for once I agree with him. We have a great healthcare system here in the United States. It is very, very, very fundamentally broken. No individual is going to be perfect. No appointment for the appointment for Health and Human Services is going to be perfect. But I think that as it stands right now, he's bringing a lot more potential good than bad. So I'm very, very cautiously optimistic.
Dr. J just mentioned how the U.S. is struggling with the obesity epidemic. I do want to throw some more numbers at our viewers. There's a recent study. It was done by a peer-reviewed medical journal. It found the number of overweight and obese people will continue to go up, reaching nearly 260 million people by 2050. The study blames, like you guys mentioned, existing policies that have failed to address obesity. Dr. I, is it the food? Is it the additives? Why is obesity so rampant in our country? And from a health department perspective, what can be done?
Bingo, bingo, bingo. It is the food and it is the additives. So the United States, the average American, 60% of our calories come from processed or ultra-processed food. When they're processing food, they're taking the good stuff out, basically. They're taking out the grain, they're taking out the nutrients, and they tend to add bad things, so preservatives and additives. Some of the additives, many of the additives that are added here in the United States are actually banned in the EU and banned in other countries. And so what can we do? What can the FDA do? What can HHS do? They can start to address these things. It's all about corporate America, right? It's all about the bottom line at the end of the day. And if we can start to get some of these things that are actually banned in the EU out of our food, if we can start focusing on fresh foods instead of these ultra-processed and processed foods, we will see a huge, huge drop in obesity and all of the obesity-related conditions.
Let's talk about...
Hey, can I just add one thing?
Please do.
I was going to say, he mentioned the EU versus the United States.
Yeah.
Do you know that there are 10,000 food additives that are approved for use in the United States? In Europe, 300. 10,000 versus 300. That tells you a lot.
Yeah, quite the discrepancy there. Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.